Hello, my name is Sarab Sodhi, and today we're going to talk briefly about nerve blocks. Now, first and foremost, we're going to talk briefly about why you should care about this. I understand you guys are just going through your SMS block, but the reason I think this is most relevant, despite the fact that you're very preclinical, is that this is probably one of the most useful things in the armamentarium of a physician who's trying to take care of someone with acute pain. So, one of the things that can be very helpful is you can deliver targeted analgesia and pain control at a location using anatomy and an ultrasound to make it a little bit safer so that you don't have to give, for example, the little old lady with a broken hip a bunch of a sedating opioid like morphine that might potentially make her stop breathing or have a bad outcome. And then for a number of these, especially going back to hip fractures, there's a good amount of data showing that if you give nerve blocks, patients tend to do a lot better. They tend to be able to walk quicker and leave the hospital quicker. So this is something that is probably at the beginning of where it's going to be the most exciting and develop over the course of your career. So an introduction is probably a good idea. So first and foremost, I'm going to give a bit of a shout out to anatomy. We'll talk a little bit more about the details, but what you guys need to know is what a nerve can look like. A nerve will look like a bunch of little white grape-like vesicles almost surrounding themselves. This one looks a little different because we've already started injecting in it, but this is the best clip I have. But again, it comes back to the fact that you need to know your anatomy. You need to be able to recognize what an artery looks like on ultrasound, which is this guy right here, and a vein next to it. So this is actually the femoral nerve right here. This is the femoral artery, the femoral vein. And then if you click through, you'll see right there that that the resident is injecting a little bit of fluid right around that femoral nerve, causing there to be some analgesia that will be targeted right to that spot. Now, the reason I bring this up is because you need to know your anatomy of whichever block you're trying to do. And this is where this comes back into play, and I'm sure this will give you some degree of palpitations. You don't need to memorize any of this for what we're going to do, but it's very helpful for you guys to think about what issue the patient has. So let's say, for example, someone has a big abscess on their forearm. You'd want to think about which portion of the forearm it's on and what type of block it would require. So for example, if you have something just on the wrist itself and distal to where your radius comes in to the ulna and past the wrist crease, you could probably get away with just a very simple radial nerve block. However, on the other hand, if you have someone who has an abscess up in the middle part of the forearm, you'd look at it and say that you need to get a lateral antebrachial cutaneous block along with that. And then you might potentially need to get a medial antebrachial cutaneous block. And then if those start to get super confusing, there are ways of doing plexus blocks so that you can actually just take out the entire brachial plexus. The point I'm trying to get to is depending on where your problem is, that should direct the type of block you do. And this will force you to go back and look up anatomy. Now there's a bunch of resources you can use to do that, and we'll talk more about that during the day. For the most part, you want to do these with a lot of thought. So what do you need to do this type of a block? First and foremost, you need a linear probe. Now a linear probe, it looks like it has a straight line here. A linear probe is a high-frequency probe. And the reason that's helpful is because if you remember back to your undergraduate physics, a high-frequency probe will give you a very good, crisp picture with high resolution, but it doesn't go very far, right? A lower frequency wave will go a lot further in a given medium than a higher frequency wave. But a higher frequency wave will give you a lot more resolution in a picture. And that's about the extent of the physics I want you to think about. But you want to get a probe that lets you get the highest resolution for the depth you're at. The next thing you'll obviously need to do is cover it up and project it. Now, we may have talked about this before, but the technique we're going to use is something called in-plane, which means you're going to use the needle, which will go right underneath the probe itself, and it'll come in the probe in a long axis. So what that means is you want to be able to see that needle the whole way as it's walking through. The other way of doing it is rotating the probe 90 degrees so it's perpendicular, and then you just see a tiny dot as a part of the needle. That's sort of how we teach you how to do IVs. Now, the reason you want to do this type of block in long axis is because depending on what you're blocking, right, especially popular blocks around in the neck or in the chest, that would be near the lung or would be near a vessel, you could potentially lose sight of the tip with a short axis approach and end up finding that to be buried somewhere deeper than you think it is. So especially when you're starting out with this type of a block, you want to do it in long axis. And then this is what a block looks like. So a block, there's a few different ways of doing it. You use a syringe here, with either a length of IV tubing, or we typically do to jury rig it as we use a couple of IV connectors. And then you can use a block needle, which we usually use a spinal needle instead of that because it still shows up on ultrasound reasonably well. And then this is a 2-operator technique where the first operator is holding the probe in their non-dominant hand and their needle in their dominant hand. Remember, a pointy object should always go in the hand that's better equipped to deal with it. And then the second operator has the syringe back here with some saline that they can flush through, and then they filled it up with whatever agent they're going to use to block it. Now, in years past, I'd volunteered to let some of the interns block my median nerves bilaterally so you guys could see how that went. I don't think I'm going to be doing that for the future. My median nerves can only take so much of a beating, and I suppose I do need them for patient care. But this is what that looks like. So you'll see over here, you have a high-frequency probe. That's what that L23 looks like. It gives you a square box up here. You're seeing that this is the subcutaneous tissue in the skin right here. This right here looks like a muscle belly. And then right down here, that would be a nerve. And then you can see that there is a little vessel right beneath it. And then from the beginning, you can see that this is the needle. I'm going to go back to the beginning to run through it again. They're walking the needle in. You can see that needle tip moving wonderfully. They move the probe slightly to get it back into view. And then the moment they're underneath, they put a tiny little dose of liquid in. Now, they're not quite through the fascia there, but now they move a little bit, and now they're under the fascia, and you can tell because it starts to spread the liquid out in each direction. Now, you could be as fancy as they're being here and sort of redirect the needle and move it all around the nerve without actually hitting it and inject some lidocaine or other local anesthetic of choice around it. But you don't actually have to do that. Instead, you could simply put it in one spot and just inject it there, and it'll diffuse itself all the way around just fine. As you can see, this process itself took about 45 seconds. If you have faculty who are comfortable supervising you in doing this, it can be a very fun adjunct for pain control, and it can give you a bunch of additional utility there. We can talk about various blocks we do on our day off session, and if you're curious about more of the basics, there should be some accompanying lectures for you guys to look through at your discretion. See you tomorrow.